Today, I will speak upon the illegal use of drugs and how it ought to be considered a matter of public health, not of criminal justice. According to magnetacademy.com, the word ought does not call for an action, but asks for a reevaluation of the status quo. First, I will give a brief definition of the phrase public health. According to the Center for Disease Control, or the CDC, public health is the science of protecting and improving the health of people and their communities. This work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. Overall, public health is concerned with protecting the health of the entire population. These populations can be as small as local neighborhoods or as big as an entire country or region of the world. The value premise stands to vouch that the use of illegal substances should be dealt with in a more humane and just form. To make this statement clear from the beginning, the use of illegal substances and the actions that may follow are two very different things. If someone commits a crime while high on a substance, then that crime should be dealt with according to the law. However, just the possession or intoxication itself based on the substance should not be tried as criminal, rather should be approached differently. As it stands today, there are little to no options for those struggling with substance abuse. When people are caught with possession or use, our administration chooses incarceration over treatment. Rehabilitation is a great option, however, those who suffer from this disorder cannot afford such treatment. The administration's actions regarding this matter will continue to imprison many Americans, which in turn will disproportionately hurt communities of color and waste taxpayer dollars, according to AmericanProgress.org. Incarcerating people with a substance abuse problem is very wasteful and an ignorant form of penalty. According to Columbia University, 65% of prisoners, 1.5 million people, suffer from addiction, but only 11% receive treatment behind bars. Therefore, anyone who declined help while in prison more often than not goes right back to their ways once getting released. If we take a look at the spending, it costs nearly $32,000 per prisoner per year. This method has been proven to not work, and it's a waste of time and money. We are a long ways away from a sudden effective change. However, I feel it is important to note that action is being taken place in parts of the United States. For example, the Stop Drug Diversion Program in Multnomah County, Oregon reduces rearrests by 76% and saved Oregon taxpayers nearly $80 million over a 10-year period. If this is already being something that's being implemented in parts of the United States, and it is being proven effective, maybe it's time for the rest of the US to hop on the bandwagon. According to acpjournals.org, the indirect and direct cost of illicit drug use was estimated about $200 billion relating to lost productivity, healthcare, and law enforcement's coming up to a whopping $11 billion annually. Medical complications regarding untreated citizens with substance abuse issues showed that the hospitalization for opioid use disorder rose nearly 302,000 to 520,000 from 2002 to 2012. And costs for such care quadrupled $15 billion in 2012. Just with these numbers alone, the evidence supports that for every dollar spent invested in drug prevention and treatment, the nation sees substantial savings. Next, I'm going to be talking about the different effects and therefore different treatments of illegal drug use. The most popular example that always seems to get brought up whenever talking about the criminalization of substance abuse is marijuana, and for good reason. As a child, we are taught that marijuana under any circumstance is bad, that it is a gateway drug that will lead you down a hellish rabbit hole. However, in recent years, it has not only become destigmatized, it has actually become something that has been scientifically proven to help people with many physical and mental issues. So much it has become normal to walk around any major metropolitan area and see medical or recreational marijuana dispensaries open to anyone over the age of 18 or 21. Most people who use marijuana never go on to use narcotics, and that the use of marijuana has actually been proven through various studies to decrease opioid use, addiction, and overdose rates. As it stands today, marijuana is classified as a Schedule I controlled substance under federal law. This means if caught with or under the influence of marijuana, you can be charged with the same level of rigor as someone in possession of heroin or LSD. This is very concerning and extremely inappropriate given the side effects and how drastically different people react to each Schedule I drug. According to drugpolicy.org, descheduling marijuana will facilitate medical research, ensure patient access, and remove federal prohibitions. Going back to the first point made about reevaluating the level of drug and substance abuse categories, certain drugs, in this example we are speaking about marijuana, should not be placed on the same level as higher risk drugs. According to World Psychiatry, a comprehensive public health approach should offer accessible evidence-based prevention, treatment, and recovery options to drug users and engage those who commit criminal offenses in evidence-based treatment during or following incarceration to prevent relapse. It is crucial when speaking upon something regarding tax dollars and government-backed help to assure the public of hard data and science produced by professionals in the field. This also means engaging scientific experts in policymaking. The scientific community should provide knowledge of effective prevention and treatment interventions as well as training in their implementation and ongoing evaluation. This kind of support from the scientific community would not only benefit the individual with the disorder, but it would destigmatize the abuse of drugs and allow individuals to have an open and honest conversation with loved ones. It would also help those afflicted members of society to not feel guilty or inherently bad for reaching out for help. The evidence provided supports the original claim of the illegal use of drugs ought to be considered a matter of public health rather one of criminal justice. Thank you.